In a developing story, registered nurses at Henry Ford Genesys Hospital, they're still on strike. It's day 5, and today both sides met at the bargaining table. As for what happened today, Mid-MichiganNow's Andrea Flores has the latest as negotiations continue.
Negotiations have wrapped up, but without a deal. The biggest issue continues to be nurse-to-patient ratios, and the hospital is pushing back on some of the union's claims. Teamsters Local 332 President Dan Glass says today's bargaining session didn't bring them closer to a deal. A Henry Ford Health spokesperson issued a statement saying, quote, "Today's meeting has concluded. Henry Ford Genesys Hospital leaders hope to meet with Teamsters leaders again next week. We remain committed to reaching an agreement with the Teamsters that acknowledge our nurses' unique professional expertise and is a thoughtful investment in the future of Henry Ford Genesys Hospital."
There was no sense of urgency from the employer on the core issues that we want. There was some minor improvements made.
Glass says those core issues continue to be how many nurses there are taking care of patients. The hospital says it has been able to maintain safe staffing since the strike began, in fact reporting fewer call-offs and consistently meeting its ideal nurse-to-patient ratios. The hospital also points to nearly 6,000 call-offs by Teamsters nurses so far this year, but Glass disputes those numbers.
The numbers we got on actual call-ins, people saying I'm not coming to work today, were just shy of 1,900 in a 7-month period, which is around 2.5 call-ins per person.
On the picket line, Kelsey Hayjack has been a registered nurse at the hospital for 14 years. She says there's a reason for call-offs.
In order to take any time off, I either have to find someone to cover my shift, which I tried to do, or I have to use one of my sick days in order to go and to have any time off. And the burnout is real.
Hayjack says she and her colleagues are standing firm on patient safety.
Our patient to nurse ratios have been potentially double the amount that we're supposed to have, and Henry Ford doesn't want to even include ratios in our contract.
She adds it's been difficult to be away from her patients.
To be away from them and know that they might potentially not be getting the best care inside the hospital, and it's scary, and we're very protective over them, so it's difficult to be away.
At this point, both sides agree ratios are the sticking point, but they remain divided on how to solve it. They'll be back at the table again on Wednesday and Friday if needed. Reporting in Grand Blanc Township, Andrea Flores, Mid-MichiganNow.